So the most important questions usually patients come up with is how the breast cancer patient is affected during breastfeeding. Hello everyone, I'm Dr. Sushruta, consultant breast and surgical oncology in Cytecare Hospitals, Bangalore. This mainly depends on the treatment they are undergoing. To start off with, if the patient has undergone a surgery, which could either be a mastectomy, which is removal of the entire breast, breastfeeding can be done on the other normal breast, and the breast milk produced in a single breast is more than enough to nurse a child, and in also cases of twins. But if a patient has undergone a lumpectomy, which is also known as breast conservation surgery, the breast milk quantity could be much lowered in the breast due to the injury to the breast tissue and the milk ducts and the nerves during the surgery. But if a patient is undergoing chemotherapy, it is best advised to refrain from breastfeeding because the drugs given are also secreted in the breast milk, which can pose hazardous risks to the baby. And breastfeeding can be resumed after a duration of a few weeks, which depends on the drugs which are administered. In case if a patient has undergone radiation, during and after the radiation, the breast cancer affects the amount of milk secreted from the affected breast. This also depends on the type of radiation received by the patient. Post-radiation, it could be a little difficult for the patient who is nursing the child because the thickened breast tissue, which is hardened, affects the latching of the breast. Apart from this, for specific questions pertaining to specific patients, please refer to your oncologist. I would like to close this on a note: prioritize breastfeeding and promote a sustainable and supportive system for all the breastfeeding mothers. Thank you.